Hi everyone, good afternoon. I'm sharing my screen now.
Hi, ma'am.
Hi, you all can see the screen?
Yes, ma'am.
Okay. Hi. Good afternoon. Sorry about the last week. I was very sick and I could not. I had no energy to continue with the webinar. Okay, because I was very exhausted with audit work and lots of things. So, how are you all doing? And did you guys go through that pre-webinar, sort of activity what I gave you guys, the document? It's just self-scoring, okay? So you will understand where you stand right now and what are we going to discuss, and after the discussion, what all things you have observed. So have you all gone through it? Yes or no? If no, then just go back in the group and open that document so you guys can understand what I'm actually trying to tell you. uh, I think we should start, or shall I wait for people to join for another 2-3 minutes?
Can we start, ma'am?
Yeah, we'll start in 1 minute. Just let me plug in the charger. Okay, so let's start our discussion on communication skills for all of us. Okay, so this is just a very casual discussion from my end. So I'm not really going into the details of what I really want to. Usually what I teach in my soft skills course, I'm really not teaching per se, but yeah, we are discussing some of the basic things which are needed um, in conducting the sessions, which can help you guys to understand the effective communication skills. So in 1 hour, whatever best I can try to, out of my experience, I can try to tell you guys. So I am, jumping into only those domains of communication skills for us. Okay, so what are we going to do? What is the menu card for today? We are going to discuss the basics of communication skills, like what, why, how, what to do, what not to do, how to communicate, how usually what all mistakes we do, and some case-based scenarios from my end. Of course, the importance, why communication skill is so important for us. We will discuss two things. One, as per the techniques are concerned, I'm going to talk about motivational interviewing, and a second thing is ladder of inference. So these are the two. I don't really want to call it as a technique, but I mean, yeah, it's like a technique only. What usually we do use to communicate for our patients on a regular basis. Okay, so I'm just going to give a gist of that, like what is motivational interviewing and what is ladder of inference and how we can use that during our sessions. And of course, there will be a discussion on the tips to improve the skills and Q&A from your end. Let's keep it at the end of the webinar, where we will jointly discuss some of the difficulties you guys face when it comes to communication during the sessions. Okay, so to begin with, let's jump into the most important topic. Probably you guys, I think all of us, we have once in a lifetime of our clinical journey, we guys have really thought about कि communicate करना कैसे है, and how to break the ice, or how we should handle the difficult conversations regarding the prognosis, regarding certain difficult situations, how we really need to do that. So before we really jump into the clinical communication part, I always call that whatever we are doing as a physio, let's term that as a effective clinical communication, and not a very vague term like communication skills, because communication is a very generalized term. What we are doing in our session is effective clinical communication. So to understand that, I think let's understand what is the communication. So communication is nothing but exchange of ideas, right? So right now, also we are communicating. Right now, I am also communicating. I am, I'm exchanging my idea. I'm exchanging some information. I'm exchanging some feelings. So communication is the process. It's an act by which we exchange the ideas, we exchange the information. So every communication will have, this image explains what is communication in general. Okay, so what is communication? Every communication has a sender which encodes a message, right? So I am right now is the sender. I am encoding a message for all of you. I am explaining about the communication skills, right? So every communication, whatever we are doing, has a sender and has a receiver or a recipient. So it's sounding very very simple, right? Like it's a simple process. एक sender है, एक receiver है, and communication हो रहा है. But it's very complex process when it comes to effective clinical communication. So what does the sender do? The sender encodes the message. Now that message can be a mixture of words, it can be mixture of gestures, it can be verbal, it can be non-verbal, it can be combined. And the recipient is going to decode a message. So you guys are the recipient right now and I am the sender. And you guys are decoding the message what I'm trying to convey, or the information I'm trying to convey. When we are having a face-to-face conversation, face-to-face interaction, now there is no one sender and one receiver. Okay, these two roles always pass back and forwards. So sometimes your patient will be a sender and you are going to be a receiver, and sometimes you are going to be the sender and the patient is going to be the receiver. Okay, so that's the reason we get the receiver's feedback. So receiver is sending the feedback, so the receiver has become a sender again. So this is like the whole road trip from 1 2 3 to 4 and back to 1, then again 2 3 4, again back to 1. So it's a process. That's why I call it as a process. It is a process of exchanging the information in general. Okay, that's the communication. So there is no fixed sender, there is no fixed receiver. After this discussion is over, you guys are telling me certain aspects of challenges you are facing, then I am becoming the receiver. I am decoding your message. So in our clinical communication, always this happens, that the receiver can become a sender at any point of time, and the sender can become the receiver at any point of time. That is why we must understand the art of active listening, when to draw the line between the conversation, when to stop listening to our patients and start taking the command in the communication and start talking with them. Because many times it happens that once they start talking, they wander a lot, they are going out of the track from the real conversation. And then we as a physio, we must understand where to draw the line as an active listener. So that's why it is important to understand who is sender, who is receiver, and like in general the process of communication. Okay, there are different types of communication, as we all know. It's verbal, like I am talking right now and you guys are listening, so this is a verbal communication happening. Non-verbal is when we are talking in front of the patient, or the patient is talking and we are nodding. So how we are talking, how our body language is behaving, how are we dressing, how are we, what is the tone of our voice, sometimes even the body scent. So that is a type of non-verbal communication, which I feel is extremely crucial when it comes to effective clinical communication. So how you are standing, where you are standing, what sort of footwear you're wearing, what sort of dress you're wearing, your body scent, your confidence, your entire body language plays a lot of, it is crucial actually. It is not, it's non-negotiable. So when we are talking about communication skills or the tips to improve communication skills, we need to focus a lot on the non-verbal part as well, because verbal, definitely the words you are choosing, the way you are talking, it definitely matters, because that is the core of communication, right? The words we are choosing as a physio. But the non-verbal communication is extremely important. I feel sometimes it is more important than the verbal communication, simply because our body act as an educational instrument. We are physios. Our body acts as an educational instrument. So the way you stand in front of the patient, if you are too close, you are passing a wrong information that you yourself, you're not confident to handle the patient. So you're standing very close to the patient. If you are standing very far away and you are not being an active listener, that also gives a wrong information, right? So I think non-verbal communication plays more important role than the verbal communication. So work a lot on that. If you guys are not paying attention to all these small aspects of non-verbal communication, so just pay attention to that. The another type of communication is written. So the PPT slides, what we are doing right now, social media, books, pamphlets, and infographics and all of that is also a part of communication, which is a written form of communication. Okay. Now let's understand the effective clinical communication. I feel in the whole healthcare hierarchy, our role as a physio is very unique, because we spend quite an extended period of time on a daily basis with all our patients. So that's why communication skills are crucial for us, because of this whole the time expenditure what we have with our patients. So we need effective clinical communication to educate our patients, to empower them, to de-threaten them, because when they come to us, they have a lot of anxiety, they have a lot of fear of movement, fear of pain, fear of fall, fear of walking, fear of everything. So when they are coming to us, our main role is to de-threaten them, and then empower them for the movements and the overall clinical journey. So that's why I always feel that our role as a physio is very unique in the whole multidisciplinary team, because we spend a lot of time with our patients compared to the physicians and surgeons and other multidisciplinary team. So what are the benefits of effective communication? Obviously, effective communication will improve your patient's understanding of the whole process of physiotherapy. You are helping them to gain better health outcomes, right? So if you are effectively communicating, you are sort of building a great foundation for the entire, for their entire clinical journey. Because they will continue your sessions only if you are communicating, and only if you are able to convince them effectively. So that's why the effective communication matters a lot. Naturally, it enhances your patient's satisfaction, right? So it will improve the rapport with your patient. If your patient is involved in the decision making, further, it is going to improve the entire course of the course of your session. So that's why obviously effective clinical communication is necessary. So what comes into effective clinical communication is this, empathy, and you are keeping it simple. You are ready for all sort of, like, you should be ready for all sort of reactions. Whatever you are talking, sometimes they are not able to really understand that, or they are not able to give you the required reactions maybe. So we need to be ready for all sort of reactions. uh, you need to really understand what is your patient really wants to know. So that is, I think, is the biggest challenge sometimes we face, because many times we don't understand what they really want to know, because half of the time they use chat gpt, YouTube, Instagram, Google, all of that. They have their own diagnosis, they have their own questions, they have their own understanding. So I think, as you will be more experienced in the field, I think this particular aspect will be stronger in your case. The more people you interact with, the more people you are going to experience, like the more patients you're going to experience, I think you will understand this particular aspect of what they really want to know out of the session, and then how to tackle all these jargons they speak, and like where to draw the line. So always our body language has to be hopeful, so that they will not feel that we are being very reactive, because I think we as physios, we need to be very proactive and not very reactive. So you need to really listen to what they are already knowing, and what they are already in terms of the knowledge, what they already know. Because बहुत बार ऐसे होता है अभी कि because of chat gpt and YouTube and Google and all these platforms, basically they already know pretty much about the condition, and rather they will test your knowledge, that do you know this, do you know that. And then you need to be very hopeful that whatever they are trying to convey to you, you have a confidence to understand, to listen, and then give them an answer with a lot of empathy, and keeping it all simple. So for that, I think you need to read a lot on an everyday basis to communicate effectively. So if you are not well versed with a lot of things, you're not revising the anatomy, you're not revising the basics, like biomechanics, or absolute basics like the pathophysiology of the conditions, where we can really make them understand that whatever they know from Google or from ChatGPT, there is a need to humanize it, right? So because of the very easy access to AI now, I think people have really lost it, to be very honest. So they try to really teach you in the session that, ChatGPT or Gemini, we read about this, and you are not focusing on this aspect, you are not focusing on that aspect. So somewhere you, as a physio, you need to humanize the entire process, and you have to tell them how that is superior compared to the AI knowledge they have or the Google knowledge they have. That's why, we are talking today to understand little tips and tricks to manage such situations. Okay, so this whole thing is your effective communication. It encompasses that. Okay, so what happens when we are doing the effective communication? We are basically switching between the four roles. This is what I feel, that every conversation we are having with our patients, there are you are switching between four roles. One, the physio as a confidant. So our role as a confidant includes that we must listen without any judgment, without any cultural prejudice, without any sort of judgment. Okay, so we need to allow them to have fear, we need to allow them to have frustrations, hopes, so that you become their confidant. Okay, so you need to maintain that trust and confidentiality when they are talking to you. And why it really matters, because obviously the patient comes to you with a very anxious state of mind, or they are having a lot of anxiety about the whole process of their pain or weakness or whatever complaints they have. So when they feel very heard, and when they feel that this physio is really giving me time, so they feel more compliant for the sessions, and they feel more engaged. So you have to really become their confidant to begin to begin with. So in your first session, if you don't have, if you're not playing this role of confidant, you are really not, um, you're really not working to convince them to continue the sessions. Okay, so the first thing when they come to you and it's the first session, I think you must start with this role as a physio in this whole first session of your conversation is being a confidant, because uh, they feel emotionally safe with you, they will continue the sessions. Okay, the second role is the physiotherapist as a coach. So now they trust you and they are ready to share, their whatever they're ready to you have convinced them to continue the sessions. Now I think your role should be switched to a coach, so where you are guiding their behavior, you are guiding their entire mindset about the exercises or the behavioral modifications or the whole lifestyle modification, and their habits also. So your role here as a coach is to encourage realistic goals. So you are telling them about the whole what will happen if we are continuing the sessions to your pain, or what is going to happen to your weakness or to your walking pattern or to your range of motion, to your mobility, to your function, basically. So you're encouraging them here as a coach. You're encouraging them to set realistic goals with you, and you are using the positive reinforcement. So now you are trying to convince them further to continue the sessions, to continue the exercises, or you are breaking down the task into the achievable steps, that we will do this to improve your mobility, we will do this to improve your core strength, and then your back pain will be better, something like that. Okay, so the coaching needs a language which has a lot of positive feedback. You are not bombarding them with lots of things. So you are just telling them what is achievable, and you are telling them here as a coach, you are just telling them to improve their adherence and improve their confidence to continue the sessions. Okay, then comes the third role, that is an educator. So now, as an educator, we are educating them about every single thing. We are clarifying all their questions, like you are telling them, tell me more about your pain, tell me more about your difficulties, what happens when you bend, what happens when when you do the stair climbing, or what happens when you are running, what happens when you're walking. So you as an educator, your role is to gather more and more information, when exactly the pain is worsening, what are the relieving factors for the pain. So you are observing their tone, you're observing their body language, you're giving them now a chance to talk, so that the every symptom or every hesitation becomes a clue for you to design the therapeutic strategy, right? And you are detecting a lot of emotional barriers here, कि कोई particular movement में fear है क्या, like बेंडिंग, स्पाइन बेंडिंग से ज्यादा fearful है, क्रॉस लेग सिटिंग is fearful, stair climbing is fearful. So you're gathering a lot of information here, so that you reach to a better physical therapy diagnosis and for better treatment outcomes, right? So our role here is, as an educator, is to really teach them, make them understand about the condition and improve their adherence. And then, of course, in this whole role, what we discussed, the confidant, the coach, the educator, you have to somewhere become a detective. You have to again switch from sender to recipient, recipient to sender, and you are detecting small clues in this whole role as a confidant, coach, and as an educator, right? So communication detective part is very crucial, because you are observing the tiniest details. So that gives you a better idea to progress your sessions, and also to for better understanding of everything, right? So I think these are our very important four roles which we must switch in every conversation we are doing. So become a confidant wherever it is needed, become a coach, become an educator. And communication detective is, I think, it's throughout the journey, right? Throughout the session, we are always being a detective, whether we are detecting faulty movements or posture or compensations. We must be a communication detective all throughout. Okay. And when we are doing all these things, I think we have 7 core tasks in the therapeutic conversations. Number one is opening the conversation. So sometimes when you are as a person, you are an introvert, it's very difficult to open the conversation and break the ice. How many are in the current class? How many all of you are introverts and you find difficulty in opening the conversation? Because I am an extrovert, so for me, opening a conversation is very easy because I love interacting with people. Okay, but I'm sure there must be many of you who are introverts and who don't know how to open the conversation. So, do you guys agree with this, that the opening the conversation part is a little difficult as a
Yes.
physio?
Yes, doctor.
Yeah.
Yes, ma'am.
So I think this is where many of the physios have, always, like in my soft skill course also, when I'm teaching about the communication skills in more details, like in a more clinical way, like case based and all of that, the first question that comes to their mind is this only, like, how do we really open the conversation? And I think this is the first task we have to do in any therapeutic conversation. मतलब फर्स्ट सेशन हो या तुम्हारा 100th सेशन हो, तुम्हें ओपनिंग द कॉन्वर्सेशन इज ऑलवेज डिफिकल्ट, आई फील, फॉर लॉट ऑफ पीपल who are basically, their innate nature is being a little introvert and they are not very people's person, right? So for me, as my experience, मेरे लिए इतना मुश्किल नहीं होता है. Like, I don't find this particular task out of all the 7 core tasks. I feel this task is not very difficult for me because I love interacting with people. So for me, thoda easy hai, but it's okay. Okay, first of all, you have to accept that it is difficult for you to. So acknowledgement bahut zaruri hai. Acknowledgement is very important. Opening the conversation is, the purpose of opening the conversation task is to obviously set up the tone so that you can build a rapport and you make the patient feel safe, or the patient is continuing their sessions with you, right? So you are bringing the business if you are opening the conversation. It's as simple as that. That is the purpose of this step, right? How are we going to do it? So let's talk about that. I think what I really do in my personal experience, I always start the session with a very warm greeting and very warm hello and hi, and preferably in their own language. So now I'm working in Gulf, and I'm interacting with most of the times my Arabic speaking patients. So for me, it was very, very important to learn some of the basic phrases of Arabic so that when I'm opening the conversation, they feel familiar, they feel friendly, and if that sets up the tone immediately, and that makes the environment very positive immediately because you're talking to them in their own language. So even if there are right now there are patients who are English speaking Arabic people. Okay, so they understand English, they speak English, and they are interacting with me in English. But I always prefer that I'm starting a conversation with a very warm greeting in their own language. So this I used to do it even when I was working in India. So koi Gujarati patient aata hai, I used to always start the conversation little bit in Gujarati or little something related to their culture, right? So if I'm meeting an Arabic person here, and for the morning session, I will always say Sabah al Khair, that means good morning. So there is an instant warm, feeling that, oh, like she is, greeting, or she's starting the conversation in my own language, and she's respecting my own culture. So and she's like very friendly, and she's smiling and starting the conversation. So I think the first thing is the warm greeting, which sets up the entire tone. So, and for that, you need to really understand who is your patient. So, ऐसा भी नहीं है कि बहुत over friendly start हो जाए. That can also set up a wrong impression, right? So warm greeting hona chahiye, not very over friendly, warm yet professional. So that's what I follow. So I always start the conversation with a very on a lighter tone, and like, how are you feeling and how do you feel? How was, like, if I know a little bit detail that they went outside, they had an outdoor exposure, then I will obviously come to the point that, oh, how was your yesterday's activity, and what all things you did, and tell me everything about it. And then that's how you open the conversation. If it's a new patient, if it's a first session, then the most important thing is you make a brief connection. You start with introduction of yourself, that you are so and so, and do that with absolute confidence, so that that doctor wala jo conversation hota hai na, कि हमें sister बुलाते हैं, हमें nurse बुलाते हैं, and they don't give us the respect, वो question ही नहीं आता है when you open the conversation with lot of confidence. So अगर आप ही less confident हो, and your body language is not very great, and you are interacting just as a technician, they are not going to give any respect to you as a physio or as a medical healthcare professional. Okay, so always be very set up a brief connection with them. So be very confident when you're talking and opening the conversation. That is like the most important thing. Before that, if it is possible to understand who is your patient, have a quick look, so that you connect on a cultural level also. जो इंडिया में इतना, I think it's not so difficult. यहाँ पे it made a huge difference in my all the sessions what I conduct here, because when I know their cultural background, it's very easy for me to really manage the session. For example, I have a Pushto speaking patient. I don't know if you guys are with me on my Instagram or no, but I keep sharing these things that I talk. I love learning new languages. Okay, so this is also helping me to open the conversation. So now my Pushto speaking patient, she doesn't speak Urdu, she doesn't understand English, she doesn't understand Urdu, Hindi, no other language. She only speaks in Pushto or Pakhto. So I had to learn that, like, because she's a stroke patient, and plus she's a left hemi, so right brain damage, so a lot of emotional dysregulation. So if I'm not, adaptable enough to understand how to open the conversation and set up the tone, I don't think so I'm really going to work on any of the goals for my such patients. So for you, I think, for us, I think it's very important to understand these small things if you really want better functional outcomes for your patient. So थोड़ा अपने अंदर भी वो passion होना चाहिए to go little out of the way to work on ourselves for specifically for this whole core task. Okay, opening conversation एक बार अच्छा हो गया ना, so the rest of the task what I'm going to discuss are going to be very easy for all of you. So I think these discussions what we are having are going to clear a lot of, I think, difficulties in your head. So open the conversation with confidence. And the second tip what I will give you as an experienced physio now is to work on the cultural background. So know your patient. कौन है तुम्हारा patient, ये तुम्हें जानना बहुत important है, so that you can make a brief connection with them, and that sets up the entire expectations from the session. And then you start, you will notice that, oh, they're listening to you. So everything is really based on opening the conversation. And opening the conversation does not mean कि first session का conversation में बात कर रही हूँ. I think we open the conversation in every session. Okay, so every session is like a clean slate. It's absolute plain canvas, and we are painting communication on that on every single session. So it does not matter कि आपका patient आपके पास 2 साल से आ रहा है या first session है. Every session will need this core task, which is called as opening the conversation. So I think I made myself pretty clear here what is expected from us as a physio, and what are we going to deliver, and how are we going to deliver. Okay. The second task is exploring the patient's narrative. So now you have opened the conversation. So now here the purpose is to understand their story in their own words. So यहाँ पे आपको you have to focus a lot on the non-verbal communication, where you are being an active listener, you are understanding their narratives, understanding their problems. There you are focusing on, what are they trying to tell you about their problems. And how are we going to do that? Be an active listener. So you use a lot of open-ended questions, so you get more information. And you have to listen to them without interrupting. In this particular task. Okay, so you listen to them without any judgment, without any interruptions, without any reactions. That is very important. And identify every emotion behind their story. So if your patient is coming from if your patient is a housewife and she's having a lot of shoulder pain, so understand where all that has started, and try to identify the patterns behind her painful episodes and whatever she is trying to narrate to you. So use a lot of open-ended questions to understand person behind that pain. So that's why exploring patient's narrative, I have termed it as exploring their narrative. So you understand where you want to do the like which aspect you want to really focus more. And then comes the third task, is clarifying and structuring the information. So now you have got the narrative, right? So aapko samajh aa gaya hai ki what are they trying to tell you, what is their story, how the pain started, how the pain is increasing, and how the pain is affecting their entire emotional, psychological, physical well-being. So the purpose here is to convert that into a very usable information. So जो भी information आपको मिला है, बहुत बकवास भी patients second step में जो हम discuss कर रहे थे, बहुत बार patient बहुत सारी बकवास बातें भी बोलता है. So our brain needs to really filter everything and just use the entire, like convert the entire clinical narrative into a clinically usable information जो हमारी काम की है. मेरे बेटे ने किसी इंटरकास्ट मैरिज किया, उसके बाद में मेरा शोल्डर पेन स्टार्ट हुआ. दिस इज नॉट important for us, right? So just convert their narrative into a very usable information. That is the purpose of this step. How are we going to do that? Ask very focused questions. जब वो ट्रैक से बाहर जा रहे हैं, you know that they are going out of the track. You have to bring them again into the same conversation जो आपको information जान के लेनी है about their pain, about their problems, about their lost function. So you have to ask a lot of follow-up, focused follow-up questions. You have to summarize whatever they said. Okay, so you are saying that overhead movement is increasing your pain, and so you are summarizing everything whatever they have told you, and then you are identifying the patterns, inconsistencies, any red flags, orange flag, yellow flags. You're trying to identify everything in this step. The fourth step is the clinical reasoning. Now you have gathered the information, you understood their narratives, you have opened the conversation. Now you're clinically you are doing a clinical reasoning. So what is the purpose? You are whatever clues you have gathered, you are building a hypothesis. Okay, so how are we going to do that? We are going to interpret their symptoms, we are going to understand, we are going to talk. While talking, we are going to jot down their symptoms and any particular pattern, and think aloud when it is helpful. Like this pain during the turning suggests this, or this difficulty in sit to stand suggests weakness of this muscle, weakness of that muscle. So you are going to think aloud now to really make a hypothesis, to do a lot of clinical reasoning, because uske basis pe aapke sessions aap design karoge, right? So you need to do a lot of clinical reasoning to understand their narratives and whatever useful information you have gathered. So check the understanding. Does this match with whatever you are experiencing? And then again, summarize everything here. Then comes our explanations and education part. So you are, this is again a very difficult part. I feel this particular step, the fifth step, I think it is again you guys will agree कि यहाँ पे हम बहुत सारे explanations देंगे regarding the prognosis, regarding whether the patient will be able to walk, hand function आएगा नहीं आएगा, pain कम होगा नहीं होगा, how many sessions will be needed, what do you think, and they will ask a lot of questions to you regarding the prognosis, and they will hope, like with a lot of hope in their eyes, they are going to talk and they are going to expect an answer from you. So in this step we need to really make them understand about the condition and the whole plan कि realistically क्या possible है, and realistically what all things we can achieve during the session. I think this particular step is very important for your neurological patient population, because उन्हीं में थोड़ा it's always difficult, right? Do you guys agree that the goal setting and making them understand about their condition or the relatives' expectation, so to provide explanation and education for that is, I think, the toughest part. This is what I feel. Like, do you guys agree with this?
Yes, ma'am.
Yeah, I think this particular step I also struggle many times कि अब मैं क्या explanation दूँ and मैं क्या like what should I educate. I will tell you one example of such story. So I had I don't know whether you guys know about my patient Divyansh, who is no more with us. But he was a very bright boy, and unfortunately leukemia, and then a lot of brain patches, and in the lethargic state with tracheostomy, peg tube, and all of that. And he was an achiever, hardly a 20-year-old boy. So imagine the family must be going through a lot, right? And the father is at a very respectable high post in government, and the boy was bright and studying engineering and everything. So for them, every session I used to feel very heavy to explain them that we are going slowly, or the progress is not happening the way it should happen, and at the same time be realistic, and at the same time be hopeful, be empathetic also, to understand their pain and their the whole like the whole experience they are going through. Because for them, it's the child who is bedridden, who is not doing anything, not able to talk, not able to open the eyes, not able to like partially semi-comatose state. So very difficult situation for the family to go through. But what I used to do is, every session after my session is over, I used to sit with the Divyansh's mother, for a cup of tea. Always, like, I used to manage my schedule in such a way that I had the liberty, so I did it. Okay, so I used to sit with her for 15 to 20 minutes, having my cup of tea, and then explaining her the realistic aspect of rehabilitation, and making her understand the condition and the realistic the plan. Okay, so that we are not going to achieve anything extremely functional in him, but what we are doing is we are maintaining his mobility, and we are trying our best. So I think this providing explanation and education takes a little out of the way what do you call efforts from your end. So we have to, how we are going to do, I think, like, just to begin with, you should use very simple language, no medical jargons, no medical terms. एक absolute basic तरीके से explain करना बहुत important है, so that they understand the situation of their condition and what are we doing or what are we going to achieve. So I think use a very simple language. Sometimes you use a lot of analogies and visuals to make them understand, so that they know what's going on, especially for your neurological population. And even for that matter, your ortho conditions also. And always explain why behind every instruction. So आप क्यों ये exercise करवा रहे हो, क्यों ये pattern में करवा रहे हो, why are you making them do this? You need to always explain it to the patient if the patient is able to understand, and if not, then to the caretaker or to the family members. So I think 10 to 15 minutes of your every session needs to focus on why behind every instruction, so that they know that okay, मतलब आप उनको trust भी maintain रहता है that whatever explanation you are providing makes sense, and let's trust the process further. Okay, so this is the fifth 6 core tasks what we need to do in effective clinical communication. Then, of course, we do have 6th step, that is we share a plan with them. So we build a very collaborative treatment plan. So यहाँ पे shared decision making is very important. You have to include them or the family members or the caretakers also into the treatment plan, so that it becomes a very shared kind of a decision making, and you create a very patient centric exercise plan or patient centric PT plan. So how are we going to do that? You negotiate the goals, you talk with them, understand their goals, उनको questions पूछो कि आपको क्या achieve करना है, what do you want to achieve in the session, what is your expectation. Then you discuss all the barriers कि नहीं ये मेरे हिसाब से this is goal, this particular goal is difficult right now, let's keep it for the long term goal, let's work on the short term goals. So coming to the goal part, I think I have shared a very, very nice newsletter today. If you guys have not subscribed to my newsletter, do it, because today जो आज सुबह में ही inbox में आया है newsletter is about the goal setting, especially for your neuro patients, कि कैसे goal setting करना है. So I think discussing the barriers and negotiating the goals will be very helpful to create the shared plan. Then, of course, break into the achievable steps. So whatever you want to achieve, independent walking अगर achieve करना है तो हमें ये करना पड़ेगा. So you have to break the task into achievable steps so that they understand this whole collaborative treatment plan. And then when you discuss all these things, we must ask this question in every session: is this working for you? Is this realistic for you? What do you think? Are you convinced with this? Just to understand whether we are on the same page or no. So that is our 6th step. And the 7th step is the closing the conversation. So again, the opening jitna mushkil hai, utna closing the conversation is also difficult. So we must know where to stop. Being the educator, we must know where to stop giving the feedback. We must know where to draw the line. We must know where to end the session. The conversation end kahan karna hai, that is also very difficult. And I struggle with this a lot, okay? मैं बहुत struggle करती हूँ इस चीज पे, because I talk a lot. So I really want to, talk and give information, and, I really want to have a conversation all the time with my patients or caretakers. Sometimes they are not interested. So I need to understand where to draw the line and where to close the conversation. So this whole being an extrovert personality, I think for me, opening the conversation is not a big deal. Closing the conversation is the big deal. So I, all the time I have to remind myself कि Pallavi ज़्यादा बोलना नहीं है, Pallavi ज़्यादा बोलना नहीं है. We have to cut down. We have to cut down. Keep it simple. Keep it straightforward. Draw the line. Draw the line. So I have to really tell myself about this particular task. So we have to obviously end with clarity. We have to give them a lot of confidence, motivation, and a lot of empathy here. So we have to summarize today's goals. Like, आज हमने, let's do 4 activities today, which will focus on your knee strength, which will focus on your knee pain, and which will focus on your knee mobility. So you're summarizing what are we going to do in today's session at the, before beginning the exercises. So you're communicating that with clarity. Then you are reinforcing the key instructions. So feedback, reinforcing words ज़रूरी है. What questions do you have for me? ये मैं हर session में पूछती हूँ, even if I'm seeing the patient for like 2 years now. ऐसे बहुत सारे patients यहाँ पे मैं 2023 से देख रही हूँ जो stroke patients है, neuro population है. I always ask this question: do you have any questions for me? And they have a lot of questions about diet, they have a lot of questions about medication. So you're not well versed with these things, you won't be able to answer. So आपको medications, basic pharma knowledge आपको होना ही चाहिए. If you don't know, then go back and read about it. आपको पता है आज आपको आपके stroke patient को देखना है, and you know the medications, revise them. So all these things will be very helpful to close the conversation for the day. And obviously always end the conversation with lot of reassurance कि नहीं हम कर लेंगे, we are trying our best, pain कम हो जाएगा, you will feel good after few sessions, you're going to feel better after maybe a week. So always end the conversation with a lot of reassurance. That is our job. So these are our uh, seven core tasks which we really have to do in every single damn session, whatever you are having with your patients. Okay, so from opening the conversation to closing the conversation, we are switching from all the, like, we are switching between all the tasks, whatever I have discussed. All right. So how are we going to do all these things? So there are, not going into a very much detail because this is just a very quick explanation. बट दो तीन चीजें मैं particularly यूज करती हूँ. वन इज योर मोटिवेशनल इंटरव्यूइंग. सो मोटिवेशनल इंटरव्यूइंग इज अ काउंसलिंग मेथड जिसमें आप it's a whole process which focuses on how difficult it is to make life changes, right? So it is based on a principle कि the more advice you give to your patient, कि आप उनको बहुत advice form में चीजें बता रहे हो, आपको ये करना है, you have to do this, you have to do that. अगर ये आपका tone of language है, then the more they are going to resist it. So this is the whole principle of motivational interviewing. So you have to really counsel them, but not advise them. Okay. You have to basically motivate them to change their habits and to change their lifestyle so that they find some motivation to continue their exercise sessions. So motivational interviewing, I use a lot in my sessions. How are we going to do that? So what are the steps or what we exactly do in it? One is the engaging part. So engaging simply means you have to encourage your patient to talk about their needs. तो पहला स्टेप तो यही है कि आप उनको encourage करो कि what they really want to achieve in the session. So you always focus on their, like, explore their narratives. That is the first step in motivational interviewing. Then comes the focusing part. So in focusing, you are same thing, like you are understanding their narratives and you are filtering it, what to focus. Then comes the evoking part. So evoke a conversation about the certain changes you want them to do it. So वो conversation evoke करना जरूरी है, that you need to lose your weight in order to reduce your knee pain. So you have to put it in such a way that it becomes an evoking conversation and they understand the importance of it. Many times, बहुत सारी studies हुई है इस particular चीज पे, that patients don't really like the word obese. They don't really like the word overweight. That creates a lot of negativity and a lot of negative impact. So maybe plus size, maybe words like plus size, some alternative words जो ज़्यादा negative vibes ना दे patient को, right? So evoking the conversation about the changes that you want them to have is the third step in emotional interviewing. And the planning part, that you are now you have understood, you are expressing your empathy, that you understand their beliefs and you understand their fears and their problems, and you are just telling them that they have the strength to change and to improve these habits. So they need to focus on their positives and they need to focus on their plus points. So if they will still show the resistance to some of the habits, then the part is to not to argue with them. So just listen and then don't offer any immediate solution. That's what I do. And you use a lot of open-ended questions like, how do you feel? Instead of asking them, do you have pain, which is a very straightforward question, they are going to answer yes only. There will be never a day where they say, no, I don't have pain. So how do you feel today is going to give you more idea. And then you can have more positive affirmations for them to boost their confidence, that see, yesterday the pain was less, yesterday the pain was more, and today your pain is a little bit less. So yes, we are improving. So small improvements, tiny progress, still it is going to make a lot of difference. So you have to give such positive affirmations to them. And in the planning part of motivational interviewing, what I have understood from my experience कि हमें patient का कोई भी problem fix नहीं करना है. Don't have that attitude where you want to fix their problem. Sometimes that really doesn't work. And I think if you have the attitude of fixing their problem, then many times it is very uncomfortable. Like they will resist even further for whatever solutions you are providing. So I think engaging simply means get to know your patient. Focusing means you are focusing on what needs to change. Evoking means you are telling them why we need to change, क्यों वेट कम करना है, okay? And planning means step by step कि क्या करना है, how are we going to do it. So I think these are the steps of motivational interviewing जो I use it a lot. I go in this particular way only. So I engage them, I focus, and then I evoke, and then I plan. So every single session में यही flow रहता है whenever I am trying to communicate anything. So I always engage, then I focus, and then I evoke, and then I plan. So अगर आपको you are not able to understand it, there are a lot of books also on motivational interviewing which you can read, and you can always write down these 4 steps: engaging, focusing, evoking, planning. So then you know what I'm trying to tell you. तो जितनी बार practice करोगे, it's going to be easier and easier to have a conversation with your patient and to counsel them and to help them basically. The second thing what I commonly use is also a ladder of inference. It is a tool to help someone achieve their goals systematically, step by step. Okay, so this is the ladder of inference. मैं बहुत सारे patients के लिए ये draw भी करती हूँ. So like I have S25 Ultra, तो pen निकाल के मेरे notes में I always draw this. Sometimes even during the session. So I draw this ladder ki observation, meanings, assumption, conclusion, beliefs, actions, kya karna hai. So it helps me to plan my sessions in a very systematic way. So ek ladder form mein hamesha main, I try that I'm not jumping into the conclusions, but I am really like creating a ladder here, and I am, observing the data, and I'm observing their situation, and then I'm going very step by step. So this is a very systematic approach, ladder of inference, and because of this ladder making habit, I can come to a very reasonable conclusion, and then I can talk to them with utmost confidence ki ye nahi ho sakta hai and this can happen. So I have a habit of drawing this ladder of inference a lot for my every session. Okay. So this is simply a ladder, and you are going to explain each step of the ladder to your patient. तो हमेशा हर वक्त कुछ भी complex explain करना है, ladder form में explain करो, so that it will be easy for you to explain. And जब भी आप explain कर रहे हो ना, like every step of the ladder, when you explain it to the patient, आपको खुद को भी new ideas आएंगे. You yourself, you will find very new ideas for the better reasonable conclusion. So I keep drawing a ladder of inference so many times in so many sessions ki karna kya hai. Especially for my neurological population, this works wonderful because wahi pe conversation ka thoda you find it little difficult to start the conversation and also to end the conversation. So I think start drawing this ladder of inference, like step by step approach, so you come to a very clinical reasonable conclusion. All right, so these are the 2 things which I commonly use. And if you want to really learn all these things, then you will have to, whenever next time I conduct the soft skill course, I explain this in a very detailed form कि कैसे करना है, case by case हम जाते हैं उसमें. So whenever next time I will have time to conduct that course, I will conduct, and then you guys can enroll. Okay. So क्या करना है? So this is one. ये करना नहीं है. That's why this is the red flag. Okay. इस तरीके के conversations sessions में नहीं होने चाहिए. So this is an example of that you should not do this. So this white coat lady is a physio, and this is your patient, right? So you are starting the conversation only, opening the conversation is with this question: where is the pain today? And do you have pain here when I touch? And like you start touching on different areas, and the whole conversation, up opening the conversation, he galat kar rahe ho. So you can see the apprehension on the patient's face here, that they are a little bit confused and apprehensive and anxious, and like they are very confused ki pain kahan pe ho raha hai abhi. So she's not able to explain anything about her pain because you have opened the conversation in a wrong way, right? So this is a pure red flag. ये बिल्कुल नहीं करना है. You're not supposed to start the conversation like this. The second scenario is you jump into the conclusion immediately without listening, that okay, it's your muscles, you don't bend, don't do a lot of standing work, don't do this, don't do that, and blah blah blah. So here the patient is trying to explain that, okay, doctor, I need to whatever, and you're not giving them any chance to speak, or आप एक conclusion पे आ गए हो and you are just offering them the solution. So अगर आप इस तरीके का काम कर रहे हो, then there is no difference between a technician and a physio. So ये नहीं करना है. You never offer a very direct solution कि ये ऐसा है तो ये मत करो, वो मत करो. ये checklist नहीं होनी चाहिए. Use better terminologies when you're explaining anything. Okay, so this conversation is also a red flag. Then comes again, you are just adding more and more and more advice. आप बस advices add करते जा रहे हो without giving any sort of feedback to her कि वो what has happened to her, and you're not acknowledging anything in her case. So this is also a very very like, it's a red flag, and this should not happen. Okay, that you continue your this, continue your that, and then keep an eye. So just plain advices without giving any sort of feedback. And here she's still trying to explain, and she's still anxious and still not very happy with the result. So ye nahi karna hai. This is a red flag. Instead, हमें क्या करना है? What we should do. So we should always start a conversation with warm greetings and ask her, like, how have you been since the last week we met, or how have you been and how do you feel today? So then that gives her the entire now the ball is in her court. So she starts explaining, okay, after our session that night was bad, and I had this and I had that, and I don't know if I have done too much of exercises, I'm not sure. And she starts talking about her whole situation. Then what you need to do is, okay, that means you are nodding, you are trying to explore the narrative which I explained, and you are trying to understand her side of story. So because you are giving her a feedback in terms of nodding or okay, go on, so she's now trying to tell you another aspect of her entire whatever she has done, that okay, like, I think apart from that night I'm doing okay, and I'm thinking about my movements a lot, I'm focusing on it. So this gives you an idea that she's into the session, right? So immediately you are giving her the feedback that okay, that's very good, it will get easier as you practice it, and thank you for the amazing feedback what you are giving me, and let's keep it up. So that gives her the boost to continue the exercises or continue the conversation. And then you are working in a collaboration together to set up further goals. So this is how the conversations ideally should happen. Okay, so it should always have opening the conversation, it should always have closing the conversation, and in between all the 7 steps, the task what I explained. I'm going to send you this the 7 tasks what I explained. I will send you send that PDF what I have created after the webinar. Okay, so definitely फिर आप सारे tasks you can again repeat it, and you can again check कि आप कौन से task में you are struggling and where you really need to focus. The last part of today's activity is the mistakes what we do as physio. Apart from the chota comic what I made, these are the common mistakes which I have also made, and I have learned from my experience, which I'm passing on to you guys so that you guys should not make those mistakes. Number 1 is failing to listen actively. This is the point where I was struggling a lot, because you all know, मैंने 2-3 बार बोला कि I like to talk a lot. तो मैं बहुत ज़्यादा I used to focus a lot on talking and continuously talking, and I used to have filler words also कि मैं एक पर्टिकुलर वर्ड को बहुत बार रिपीट करती थी, लाइक इट डिपेंड्स, इट डिपेंड्स, इट डिपेंड्स. दैट इज अ फिलर वर्ड, फॉर एग्जाम्पल. So when I was in college, and when we had to give a lot of journal club activities and a lot of presentations as a part of my master's program, my principal and my mentor, Dr. Subhash Khatri, I don't know if you guys know him, he told me that I have this habit of using filler words. And that actually, got stuck in my head, that, okay, I am using this one particular word so many times in a conversation, and that can have a very bad impact on patients. So if you're failing to listen actively, and if you're using these filler words, then it's not creating any professional impression onto your patient, and it's not giving any professional vibes. Okay, so this is the very very common mistake I was doing. Abhi main aisi nahi hu. Now, since almost 7 years, I have changed the entire way I conduct the session. So I conduct the session with lot of calm, like manner, and I have started reading also a lot. So lot of active listening I do. Number two mistake what we do is a lot of medical jargon we use. um, I wasn't struggling with that, because once your own concept is clear about a condition, for example, Colles fracture है और आपको पता है कि Colles fracture क्या है, so you will obviously explain it to your patient in a simplest form. तो अगर आपको खुद को नहीं पता है कि what is MCA stroke, and if you yourself don't know the pathophysiology of spasticity or flaccidity, and why weakness is happening and why this is happening, then you won't be able to explain it to your patients in the simple way, right? So you have to understand your own, like you have to clear your own concept before explaining any medical terms to them. So no using medical jargons, no using big words. That is a setback in the session. Okay. Neglecting the feedback, again, I was making this mistake. Because I have a habit of talking a lot, so lot of time the feedback what they were giving me, I was neglecting that. So that is also one of the common mistake we do. You have to acknowledge the feedback they are giving and not to take everything personally. ये भी थोड़ा एक मेरा issue था कि बहुत personally मुझे लगता था कि I am not able to achieve any result in this patient. Like I'm so bad in ortho. I had cases जहाँ पे मैंने patients की back pain increase किए हैं, and I used to feel very 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 bad about it, that like I'm not able to do this, and I'm just like I was taking it too personally, I feel. Then I realized that, see boss, ortho is not my cup of tea, and I am not going to cry about this thing, that I am managing one of the most complex neurological cases and I am acing it. So that is my cup of tea. So if you are ortho is not your cup of tea, and you are still, you have to treat those cases, then you have to understand this concept, that you are not going to take everything personally, because now I'm working here in a multidisciplinary thing, right? So I'm treating ortho also, I'm treating neuro also, and post-op cases also, and a lot of complex cases. So there are times jahan pe patient is not happy with my session. So I have to understand this feedback, and I have to work on myself so that I don't really induce the same mistakes again. So personally kuch bhi nahi lena hai, because we all have our plus points, and just we must focus on developing an attitude towards accepting the feedback and criticism. Okay, so don't neglect any sort of feedback they are giving you. Lack of cultural awareness is also something we must focus. If you are culturally sensitive now, then you can be adaptable in any situation. For example, I have come from a different background, and I'm here in multi-nationalities, right? So some of my patients are Christians, some of them are locals, the Arabic speaking people, they are Muslims, some of them have different cultural values than what I have. And it's very good to have a cultural awareness and cultural sensitivity, so that you go at a root level, and you treat your patients with utmost dignity. For example, now I am a Hindu, and if my patient is Muslim, and if I don't know about anything about her culture, how am I going to help her to go back to her namaz positions, right? If I don't know anything about their, their prayer positions, because for them they go in the prayer position in a particular sequence. So, agar ye cheez mujhe pata hi nahi hai, if I'm not culturally aware of it, how am I going to really help her with her knee pain and explain it to her that now you cannot go in this particular position of your namaz? So we have to modify that. Okay, so this is what I have learned here in UAE about the whole cultural awareness, and how we can mold ourselves and be a little more adaptable in this whole cultural environment, which is so different from what it was when I was practicing in India. And the reactive responses, what you are giving, you need to be really careful about that, so that you don't hurt any of the religious sentiments, any of the cultural sentiments of your patients. So your reactive responses should be very subtle, because there are people here who have three wives. Okay, and for me this was a very cultural it was a cultural shock, because I come from a country where all these things are not very commonly seen, that all three wives are living in the same house. And for me it was a different cultural experience when I came here. And if I would have reacted to it, it would have been very unprofessional. So you need to understand all these aspects also of your patients, that and do not give any sort of reactive responses on these things, because it should not matter to you. You are going to treat them without any judgment and without any prejudiced mind. So work on your reactive responses. Okay, so these are the most common communication mistakes we all make, which we should work on every day. Okay, so what are the final for today's discussion? What are the tips for quick tips for your effective communication? Number one is, of course, be attentive. So that's how you're going to build rapport with your patients. So you have to be attentive. You have to understand. You have to understand their ideologies, their fears, their uncertainties, everything. So just be attentive in the session. अगर आप phone scroll कर रहे हो, patient को आपने ultrasound आप दे रहे हो, and that's what you call a physical therapy session, then you need to really take a call whether you're doing right in your life or no. So you have to be very attentive, and जो भी opportunities आपको मिल रही है to understand your patient, just grab them. Okay. Second is, let people talk and don't interrupt a lot. It is for people like me who love to talk a lot and who love to interact a lot. So it is specifically for all the extroverts out there, that let people talk and don't interrupt a lot. Okay. Then involve yourself in listening. So do a lot of active listening, and put a filter in your brain, how you're putting a filter on your face. Put a filter in your brain to filter the nonsense your patient is talking, and just take the clinically usable information. Okay, so involve only in that, and it will come with a practice. Okay, next is make eye contact, take notes, and work on your body language, because remember my words, our bodies, as a physios, our body is an educational instrument. We are literally using it as an educational instrument. So please work on your body language. आप कैसे बात करते हो, कैसे बैठ रहे हो, कैसे standing में हो, and what is your posture and how you are dressing yourselves. Everything matters. Okay. And a lot of open-ended questions of when, what, how, where, instead of very direct questions. Open-ended questions will give you an idea about their narrative. So use a lot of those questions. And don't keep asking only the questions. Try to have a conversation, try to understand, try to give your what you call your experience to them about maybe experience of the same other patient you are handling with the same diagnosis. So try to have a conversation. Then of course find some common ground to start the conversation. This always works when it comes to opening the conversation. So to all my introvert fellas, you guys have to find a common ground so that you can break the ice. So if you are introvert and you don't know how to start the conversation, this is like the easiest trick. You find a common ground to start the conversation, and then you will see that the conversation is flowing very easily. Then don't jump directly into the problems, as we saw in the in that comic, that you are like, don't just jump into the problems they are facing. They will feel that you are not empathetic enough to understand the situation, and like you are very money minded. That is also one common misconception they have, कि उस फिजियो ने हमें टाइम ही नहीं दिया, उसको बस पैसे चाहिए थे तो पैसे लेके निकल गया. Of course पैसे चाहिए होते हैं, we are doing business, we are doing work for that only, but do it in more empathetic way. Okay, empathize with them, so validate whatever they are telling you, and be very straightforward in some of the conversations. Summarize and just understand if you have heard it clearly, so you have heard it correctly, and if you have heard their problem clearly or no. So summarize everything, and use the right tone of your voice. So voice modulation एक बहुत ही different topic है, जिसपे शायद कभी एक free webinar, I think I must do it, कि हमने voice modulation कैसे करना चाहिए, how we should really modulate our tone of our voice to get best of the responses, because this really is needed especially in neurological population. Okay, तो आप अगर बहुत soft command दे रहे हो, you will never get a movement. If you're giving a very firm command, you will instantly get the movement. So I think voice modulation is very, very important topic. Again, maybe I think I will arrange one absolute free webinar on just this topic, like how to modulate your tone of your voice. So communicate in different ways. Use verbal, sometimes non-verbal, sometimes written, videos, all different forms of communication. You must use it in your sessions, so that the client will come to you again and again, and they will not stop the sessions, and you will get a good revenue and a good business also. Okay, so this is all about today's a quick webinar on these things. I hope कि whatever we have discussed, you guys have understood it pretty much. So let's do some Q&A. Whatever questions you guys have, ask me only from this communication point of view. Okay, don't ask me questions कि इसको कैसे treat करना है, उसको कैसे treat करना है. Just from a communication point of view, if you guys have